I am a black belt because because I got a transplant on in November is the 26th of 2023, and now I am recovering of my transplant and staying here for like about the 3 weeks or so.
Brandon is an 11-year-old boy who had congenital heart disease, anatomic defects of the heart that causes the heart to be less functional than what his needs of the body are. And he came to us following a heart transplant. He had multiple surgeries, but he eventually did need the heart transplant. His post-op course was complicated by a stroke, so he had weakness on his left side. He came to Blythedale because he needed intensive and comprehensive therapy to get better, to make functional gains.
I like is Catherine's like is positivity about me and and the games is the way we like to play and bond together. Yeah. And with Linda is I like to have these conversations about her son and life. Yeah. And just I tell her about my breakfast and she tells me about her breakfast and lunch also.
He was a normally functioning child before. He could walk, he could climb stairs, he could talk. He had full use of his upper extremities to do things. All of this was something that was impacted by the complications that followed his heart transplant. So he needed to become stronger and relearn these skills. The other thing that he needed to do is work with us to try to ensure that he wasn't going to reject the heart. So he was on anti-rejection meds. This requires careful follow-up with his cardiac team over there, so it's a coordination of services between the teams that have to take care of him. He worked very hard in his therapies. He's way mature beyond his years. He is a pleasure to work with, and he's finally able to go home. He's going to transition to our day hospital service here so he can continue to work on his therapy goals, but he's doing great.
So when Brandon transitions to day hospital, one of the benefits of being in our program is that we can continue to monitor him medically in collaboration with the cardiology team at Columbia. So as they're titrating medication, doing a heart biopsy to monitor for rejection, and checking his labs regularly, we'll have the ability to make adjustments to his medications based on their recommendations. We can monitor him really closely for those signs of rejection or heart failure and things like that that may be more difficult to do in a community school.
I like about school is math, social studies, history, and science, and reading, ELA also.
For a lot of patients who are post-transplant who have pretty significant immunosuppression, most of those children would end up with home instruction and some therapies either in the home or in the community depending on where they live and what they really needed. The benefit of our program is that he can come to school. You know, he is immunocompromised, but we are going to be watching him quite closely and we can intervene very quickly if we need to. But he's going to be able to go to school and be with his peers, which I think is a huge benefit, especially for a child who's been in the medical system so frequently as he's been and had to miss a lot of school in his lifetime. I think it's a huge benefit to him that he's going to be able to come, go to school, and have, you know, as much of a normal life in that regard as he possibly can at this point, given that it's not really safe for him to go back to his community school yet.
What's my future?
Yeah.
My future is to go to Disneyland. With my family and friends, and spend time with them. Thank you for just all the medicine that you gave me and supporting me and just taking care of me.